Have you ever had any mucus like consistency or fluid discharge in your underwear, especially the day that when you are working out, doing activity outdoor, or just simply spending the day at home doing yoga and meditation? The fluid discharge that you experience is actually how your vagina protects you from any infection and keep your vagina clean and moist. Just like how your tears protect your eyes from any infections, as they help to moisten them and clean out any dirt, dust, or other allergen from eyes.
Most women have a 28-day menstrual cycle, and hormones during the cycle cause your cervical mucus to change in color, texture, and volume. This is very useful in identifying when you're most fertile. Isn't this amazing how your discharge can actually track the fertility cycle? The cervical mucus is thick, white, and dry on the 6th to 9th day after menstruation. Before ovulation, on the 10th to the 13th day, it turns stretchy and the texture resembles that of an egg white. When your ovary is ready to release an egg, usually on the 14th day of cycle, the discharge turns clear and slippery. The increased wetness of the vagina makes it easier for sperm to swim up to the egg for fertilization. This type of discharge tells you that it is time for sex and the best time to get pregnant. Think of your uterus as a swimming pool, your cervical mucus as water, and the sperm as a person trying to swim. If the water was thick or mud-like, there is no way a person could swim through it to reach the other side of the pool. This is how hard it is for the sperm to reach the egg if the cervical mucus is thick and dry.
Escucha las palabras de las brujas, los secretos escondidos en la noche. Los antiguos dioses invocamos ahora la obra de la magia oculta.
Now we're going to talk about abnormal vaginal discharge. There are always two sides to the coin, and the same way we cannot ignore the side of abnormal vaginal discharge. Because it usually is a sign of infection, and so it needs to be checked and treated by doctor. The signs that could indicate infection are 1. Changes in color, consistency, or amount. 2. Itching, discomfort, or a rash. 3. Vaginal burning during urination. 4. The presence of blood when it's not time for your period, or pain during intercourse. 5. A foul odor. 6. Pain in pelvic area, abdomen, or pain during intercourse. Let's look what is different kind of abnormal vaginal discharge indicate. If your discharge is thick, whitish to pale yellow and cheesy in appearance, accompanied by vaginal itching or burning, you most likely have a vaginal yeast infection. If you have a discharge that is heavier than usual, that is watery and grayish in color, with a foul fishy odor, you likely have bacterial vaginosis. This is the most common vaginal infection. It happens when there is imbalance between the good and bad bacteria. That's a usual found in the vagina. It usually occurs in women of ages 15 to 44. Certain use of antibiotics can cause this type of infection. There may or may not be presence of itching, burning, or swelling of vagina and vulva. If you have unprotected sex, a parasitic infection can occur which can cause frothy, yellow, or greenish discharge with a bad smell. This type of infection is known as trichomoniasis. It can cause pain and itching while urinating.
There are a few measures that everyone can do to maintain the pH of vagina and prevent vaginal infections from occurring. Always wear cotton underwear, as cotton allows your genital area to breathe. Avoid wearing overly tight clothing for prolonged periods of time. Keep the vagina clean by washing with a gentle, mild soap only on the outside. The inside of vagina should only be cleaned with water. Never use petroleum jelly or oils for vaginal lubrication. This can create a breeding ground for bacteria to grow. Avoid applying any vaginal products such as perfume or deodorant, soaps, powders, and lotions. During treatment for a vaginal infection, use all the medications as directed by your physician. If you are having a vaginal infection accompanied with itching, always avoid scratching infected inflamed areas, as scratching will only make things worse. Always use protection during sexual intercourse. After going to the bathroom, always wipe your genitals from front to back with dry tissue to prevent bacteria from getting in the vagina and causing an infection. Good hygiene, getting plenty of sleep, and a good diet with the right amount of fluid intake is recommended for good vaginal health.